Hey girl, Marissa here. You are listening to the Codependent Dummy podcast. As a young woman, you have been raised, reinforced, and rewarded for putting the needs of others above your own. Now, in your 20s, you're finding yourself exhausted, exasperated, and enveloped in shit relationships, especially the one you have with yourself. Codependency is a way of being where we put the feelings, wants, and needs of others above our own in an unconscious attempt to meet our own feelings, wants, and needs. Sorry to break it to you, sis, but that is not sustainable. This podcast is to help you undo all that so you can stop playing small and start taking up space, you dummy. Let's get to it. Hey girl, hey. It's your girl, Marissa here, checking in. I am so excited for you guys to hear my interview with Dr. Ann today about dynamic therapy. But before it officially airs, I want to give you the heads up that I had some fun recording with the audio and video. So the video, it looks like it does, and I'm out of focus, and I apologize, but I just messed up the settings, so there's that. And I had to record at my parents' house, my beloved parents, because I was getting some work done at my house, and there was a lot of banging and drills and loud noises going on. So during the interview, you can hear my dad using a leaf blower because he decided to use a leaf blower during the recording. And I think you might also hear my computer. My computer was insanely loud, whirring during this interview. So I apologize, but and there was a delay. So every time I asked Dr. Ann a question, I would finish my question like, how do you define codependency? And there's a pause like this. Just like that. So I ask for your patience, kindness, compassion, understanding today with the audio and the video. I thank you for being here, and I love you. Okay, here's Dr. Ann. Hello, everyone, and welcome back to the Codependent podcast. Today, I'm sitting with Dr. Ann Krajewski. Dr. Ann is a licensed clinical psychologist in private practice in Virginia. She works with adults who struggle with anxiety, perfectionism, low self-esteem, and codependency. She assists her clients in healing their relationship with others and themselves so they can live a more full and satisfying life. Dr. Ann, welcome to the podcast.
Thank you. It's good to be here.
Awesome. All right, so we'll start with the typical two. I'm curious, how do you conceptualize codependency?
So I feel like as I was thinking or preparing to be here today, what I really kind of boiled down to in my mind is that somewhere along the way, someone kind of who experiences codependency, it had something that happened to them or some type of relationship that caused an underdevelopment of their sense of self or wounded their sense of self in a way that disconnected themselves from their thoughts and feelings and their wants and needs, and also hyper tuned themselves to the thoughts and needs and wants of others. And so I think that can impact someone in a variety of different ways. Like it makes them hard to trust themselves, or it kind of causes them to kind of have like they don't know where they begin and someone else ends, and so it can make relationships messy. But I think, yeah, kind of boils down to being disconnected from themselves and kind of very attuned to others to try and create a sense of safety or to kind of feel okay.
Right. My mind goes, do you have an example of what that something that happened to them, what that might look like?
Sure. So I think a very classic one would probably be having a more emotionally immature, or as we call it today, like narcissistic parent. I think that kind of is a very popular, subject nowadays. But I think usually, like if a parent emotionally relies on a child, like if the person kind of the parent needs them to be something specific for them or relies on them for something, I think that can cause a underdevelopment and then some sense of self, where it's more about the parent and less about them. But I also think like traumatic experiences or kind of abuse or things like that can also be events. So more chronic things, but also I could imagine more kind of more one time or kind of trauma.
Mm-hmm. Right. Okay. And so before we get into your specialty, the dynamic approach to therapy, I'm curious, do you have a codependent experience from your own life that you can share with us?
Sure. I think there was a couple that came to mind. I think one being that I guess probably a more kind of surface level one is starting my own business. I think for a long time, I was in my doctoral program and I was in a lot of supervision, and there was a lot of relying on others and needing to kind of um, trust or believe what someone else thought or said to try to kind of get through the process. And I think as I graduated and wanted to get into private practice, I really found this um, kind of not knowing if I could rely on myself, or not knowing, kind of feeling like this sense of needing to kind of depend on someone else, like what they thought or what they thought was like the best way to go. And so making the transition to kind of really thinking like, well, what do I want? What do I think about people? How do I see kind of healing happen? I think it took a lot of um, inner work to feel more secure in myself and feel more confident in being on my own, like developing a website or um, really marketing myself. I think there was a part of me that just kind of wanted to follow someone else and
Right.
kind of trust them and think that what they were doing was kind of what, just relying on that. And so venturing on into my own, yeah, it just took a lot of um, work around that. And so I think that was the one that was more recent. I think a couple others came to mind, but I think that kind of, yeah.
Mm-hmm. And initially, did you find someone to rely and depend on, or was there just the urge to have someone?
So I would say I really got into the like therapy world or therapy space of like group programs or like reading blogs and really trying to rely on kind of what other people were saying, or like this is how you should do it, or um this is like the best practice. And so I think I found myself really wanting to overemphasize what other people were saying, or these kind of group, or I guess these people who specialized in developing private practices, or that was kind of their niche. I think I wanted to be like, oh, well, this is exactly how it needs to be, rather than really thinking, okay, well, what's best for me? What do I want? How do I want this process to go? And I think also just there was a lot in my mind about it as well, like what past supervisors have said, or I was in a group practice at the time. And I think my mind kind of was like, okay, well, this supervisor said I should do it this way, or and the supervisor really didn't like that I was psychodynamic, and so there's an anxiety about like labeling myself that way. So I think there's present people that I was doing that with, but then also kind of internalized sense from others as well that
Right.
was kind of circling around in my mind.
Yeah, you're reminding me. I remember going to a conference. I think it was early on when I had started my private practice, and I saw this speaker, and she talked about for a whole year, she didn't turn down any speaking opportunity. So if it was like at a senior center, a church, a college campus, she just said yes to everything. And she basically provided a workshop or talk every day. And I thought, I need to do that. Like, and
Yeah.
like, no, like I am kind of, I prefer this. I prefer interviewing someone and getting in depth about a topic and then uploading it for all the listeners to hear. But, speaking with 500 people, yeah, it's not necessarily aligned with, like how I want to, cultivate my practice. But I think for a while I took that and ran with it. And it's really hard to, especially like being codependent, it just pops up everywhere. And so, with starting a business, you can just, cling and depend on the guidance of, past people who you carry internally, or present people who you just follow without a lot of critical thought.
Yeah,
Yeah.
absolutely.
You talked about a recent, like, do you want to bring up a past codependent experience? Like, does that suffice?
Well, I guess something that was felt well, it was a little bit more of a personal example is that I think I think codependency is something that I've kind of dealt with in my life, and I have been to, an extensive amount of therapy at this point, and I think I had worked through a lot of it, but within the last couple of years, I was in a long-term relationship that ended, and I think a lot of those codependent thoughts and feelings came up, like, like my life is over. How am I going to survive? Like what? Like I like really needed this person, and so I think that was something that I really struggled with, of this idea of like, who am I? And we were together for several years. And we were together through a lot of my healing, that I think ending that relationship really brought up the unhealed parts of my sense of self and relationships. And so, and in some way, like it was a devastating experience and very hard, but I think it also gave me some blind spots that then kind of I was able to really focus on and understand. And I feel like through that process, I've been able to feel much more secure in my sense of self, or like who I am, rather than needing to feel like I need another person to be happy and to feel fulfilled. Like I think I for a long time thought I needed a partner to be happy, but then kind of working through those feelings, I think has helped me so much in my life, and helped me feel much more free. Like I don't need to obsess about finding someone or keeping a relationship because I can't be alone or something like that. And so I think that was another one that was coming to my mind.
That's huge.
Yeah, it felt huge.
Yeah. Wow. Okay. Well, let's shift into your specialty, right? You already mentioned, yeah, specializing in the psychodynamic approach. So, for the listener who isn't familiar, what is the dynamic approach to therapy?
Sure. So I would say so psychodynamic is probably the more kind of known term, but I would say I kind of fall also under the psychoanalytic approach. And within that, there's a variety of different ways of um, looking at the person, depending on kind of like if your ego psychology or your object relations, kind of more jargony things. But in general, I would say it's really helping someone understand their internal world and how that internal world developed, how it's sustained, and really overall being able to put words to their experience rather than kind of feeling like things getting acted out because it's hard to put words to that experience.
Hmm.
And kind of having that insight so that then they can kind of have room to create a different experience or move in a different direction rather than kind of being stuck in these patterns that kind of somehow keep going on despite trying to change them. So yeah.
Mm-hmm. What comes to mind when I ask, like, for a common codependent pattern that, yeah, you've observed people have been able to put words to, or yeah, you've helped them put words to it so they can have insight and potentially, yeah, change that pattern?
So I would say one that really stands out for when it comes to codependency for me is people's experience of anger towards others. I think people who really struggle with codependency kind of put so much emphasis and so much priority on maintaining relationship, and there's so much fear about how it might end or what they might do that might jeopardize or damage the relationship, and then they'll lose this person that they feel like they need to sustain themselves. And so I think an emotion that really impacts that is anger, because it kind of typically pulls us to set a boundary or advocate for ourselves, which then can upset the other person or um, and so I think with codependency, oftentimes that anger gets transformed into like anger towards oneself. And so then they
Mm-hmm.
start kind of being like, oh, I'm worthless, I'm terrible, like this is my fault. Um, like I need to change myself so that this relationship can keep going on. And I think oftentimes those things are very unconscious. Like it's someone's not actively, maybe thinking those things, but over time, I think it becomes this baseline automatic response in relationships. So, like, if someone's codependent and they're they're at work and their boss is maybe a little bit more abusive, like they're kind of don't have very, helpful ways of managing them, or like they kind of want them to work more or they berate them or something, the person with codependency will be like, yeah, you're right, I'm terrible, like I need to be better, and how dare I not like be great at this, when really what they're probably very angry at their boss for kind of criticizing them and overstepping their boundaries, making them work longer than they're contracted to work, things like that. And so obviously I think it spans in all of their relationships. So that's kind of a more
Mm-hmm.
one that might come up at work or but I think that's one pattern that I find very often.
Yeah, I agree. Like, have you observed, Dr. Ann, like in general, is there, I don't know, this might be like too broad, but like, do you sense like anger is a common theme with codependence, like being unaware of, or you're like, sometimes it's sadness, sometimes it's envy, or yeah, is there like a more popular underlying emotion with codependence?
I mean, I think in my mind, anger is a big one. But I also think there's a big sense of grief around, I think, especially with people who develop codependency from kind of their relationship with their parents. I think really underneath the surface, deep down, is a sense of grief that they didn't experience the parents that they really needed, or the parents that they, kind of wanted, or yeah, a variety of kind of things. But I think that's also a big one, is kind of feeling like that sense of loss around a parent that honors their needs and is curious about them and helps them kind of develop. Because I think oftentimes they're the relationships that they experienced this kind of trauma or underdevelopment of their sense of self with, which is, I think, oftentimes parents, but it can be other relationships as well. But it can cause them to then try and get that need or something met with someone else, like a partner or a friend or teachers or authority. And instead of being like, they kind of try to get it met rather than healing the original wound that they didn't get it met from their parent, which ultimately, especially their parent as a child, like their parent obviously changes and isn't the same parent. And so, yeah, I think it's really, so dealing with that original grief around the wound that kind of originated these thoughts and feelings or patterns is a big one in my mind.
Right. So let me make sure I'm hearing you. So with anger, one potential way, right, that codependents can put words to their experience, right, create this insight and change this pattern. So they have this, I'm worthless, I'm a terrible employee, when really there's underlying anger towards their crappy or poor managing boss. And then with grief, right, putting words into their experience, insight to change that pattern. It could be like becoming aware that they're basically trying to, they're just like really committed to someone, and underneath that is grief to the needs that weren't met in a previous relationship, like potentially with parents.
Yeah.
So then helping them get in touch with the anger, get in touch with the grief. So then, they don't necessarily have to keep dating their parent and or stay in crappy work situations. Yeah. Okay. I'm curious, like, your thoughts on how like, what is the lens that the psychodynamic approach perceives codependency? And how can it help potentially treat codependency?
Yeah, I think it probably really depends on the kind of the lens within psychodynamic you're using. So, like, for example, a more relational lens would probably really focus on the relational needs that weren't met in childhood or weren't met throughout their life, and trying to use the relationship between like the therapist and the client to help develop that. So, for example, whenever the person expressed a need, or whenever a person kind of used their voice or prioritized kind of what they thought or were feeling, their parent might have, been like, no, you're feeling this way, or no, like, you're not allowed to be angry, or kind of was then blamed them or attacked them or something. They would see kind of that like that kind of creating this underdevelopment of their sense of self, or it didn't feel safe to have thoughts or needs. And so then trying to create an environment where kind of they're starting to heal that sense that they do feel safe, that they can have agency, they can have thoughts and needs within the context of the therapeutic relationship, but then hopefully help them, hopefully that then they'll also be able to get connected to people outside of therapy that set boundaries with those like people, or move towards relationships where they are able to, like, those people do respect them or do care about their thoughts and needs, so that then they're kind of able to have more like fulfilling relationships, rather than kind of getting stuck in these relationships that kind of recreate the pattern that they don't have the thoughts or needs, or help them then be able to share what they want or need in their life.
Right.
So that would be one approach. And then kind of with the anger, what I was talking about, like more of an internal approach of like maybe a more ego psychology, is like understanding like what mechanisms inside of themselves, or what they're using to manage thoughts or feelings. So example, managing their rage towards someone who's hurting them, that then they turn around and hurt themselves. Like the kind of someone who's more into thinking about those defenses would then help the person kind of understand that kind of what was the original thing that happened, and kind of then think about how else they could respond besides turning against themselves, like what other kind of ways or defenses they could use to help manage those feelings. So I think I think I would say I use a variety of those things, but so I think there's a different ways of approaching it that I think are all helpful, but kind of have different lenses or different ways of approaching the kind of problem.
You bring up defenses. I'm curious, like, do you notice any common defenses that codependents tend to have? Like, I don't know, like identifying with the aggressor. That's what we can explain it to the listeners, but yeah, I don't know, like what defenses come to mind as like commonly used by codependents?
Well, I think one which we've kind of touched on is turning against the self. So kind of taking the anger they're feeling towards someone and internalizing it, and kind of making it about themselves, or how they're the problem, or they're the issue, so that then they don't have to tolerate the anger that they have towards someone else, which might feel very dangerous. Another one I would say that's common is projection. Like, I think when they feel angry, it's hard to tolerate that. And so then they perceive the other person being angry at them. Like, let's say someone, like with texting, for example, if someone was like really short with them, they might be angry that this person isn't communicating with them the way they want. But instead of maybe being able to hold that this person isn't this person isn't meeting their needs in the way that they want, then instead they perceive the other person as being angry and hating them, or oh, this person doesn't like me. So I think that's one. And then another one that I think is pretty common is something called reaction formation, which is transforming one emotion to another. So it's like, instead of, like, let's say that professor that they really do not like because that professor is critical or mean, or doesn't care about them or whatever, instead of kind of being able to feel that anger or whatever, or even, I think you said envy. I think envy is another one. Like, instead of like feeling that envy towards someone, all of a sudden they're like, oh my God, you're so amazing. Like, I love you. Like, I'm obsessed. You're so cool. Or, wow, you're so helpful. Like, I don't know, like, what I would do without you, or something, like that, where it kind of gets transformed into something else, is another one that I think can happen. as well. I think that one, I think a popular term that is around nowadays is the like fawning as a fear response. So kind of really moving towards the person and trying to please them and kind of idealism. I think probably I would see reaction formation really going along with that of kind of like moving towards that person and idealizing them or, you know, something like that.
Yeah. And then I mentioned identifying with the aggressor, and like as you're speaking, I'm like, what is that one? So, or yeah, how would that look in codependency? I'm trying to, well, yeah, if my boss is not necessarily like an aggressor, but just yeah, like poor at managing, like yeah, really like harsh or just like wants me to overwork. And then maybe if I do well and I'm codependent and I move up, then I have the same expectations with those who I manage because I've like totally blindly aligned myself with how they manage, right?
Yeah. Yeah.
Yeah. Yeah. That's a
Or
hard
even
one.
I think like, yeah, like the judgment that they internalize from those people or their parents or teachers or whoever, and then they turn around and like have that same judgment, obviously towards themselves, but also other people. But I think that, yeah, it definitely feels very true of they internalize it and then kind of identify with it and then expect kind of others to do the same. So yeah, that definitely feels like it applies too.
Yeah. And just for everyone's review, I feel like we've touched on defenses previously, but I mean, you know, the power of the psychodynamic approach, right, is you help your patients like put words into this experience. They create insight and change, but defenses starting out are not conscious, right? We're not like, oh, I'm going to transform this emotion into something useful. It's like
Yeah.
it's totally right way
Yeah.
underneath. Yeah.
Yes. Yeah.
Okay. So with your patients, Dr. Ann, what are the initial steps you take to help them heal their relationships with others and themselves?
I would say probably the initial steps would be to really understand what's actually happening for them. And really, yeah, so trying to be curious about like what they're thinking or feeling, what maybe was actually happening in a certain situation or what might have been their response. So really just trying to get clear around what the reality of the situation is or kind of what their internal experience is about it. So kind of being curious about, because I think oftentimes with people who are codependent, when you talk with them, they can oftentimes talk about other people or what other people are thinking or feeling or what other people said about the situation. So one thing would be kind of like, what do you think about it? Or what are you feeling about it? I think is one. And then I think also something that I find helpful is helping give them agency in the room. So I think oftentimes people who are codependent want me to provide the content of the session or want me to be directing it, or they kind of want me to fill the space in some way, and kind of trying to create a different experience for them where I'm not making it about myself like other people in their relationships might, and really trying to help them kind of be able to take up that space. And I think it's deeply uncomfortable for like for people who are codependent to do that. But I think kind of having that kind of helps them start thinking for themselves rather than kind of falling into the pattern of being in another relationship that tells them kind of what to do or how to think. And so I think those are a couple of things that come to my mind, and I think are things that happen throughout the experience, but
Right.
I think are ones that I'm very conscious of.
Mm-hmm. Right. Helping them understand what is happening, what they're thinking, feeling, get clear, the reality. What do you think? What do you feel? And I'm curious, like your experience, like with patients who come in self-identified as codependents versus those who are but aren't aware of it, like me when I first started therapy. What is
Yeah.
your experience like? Like I'm curious, like what is it like for you, like first session or early sessions, and it's a bunch of like, well, we went to the gym, and then if they're like a weir and they just talk about, or like, right, so enmeshed with their families. I remember, I think I've talked about this on the podcast, but my parents in our 20s had a really they had conflict with my twin about her cell phone use, and we were all on a family plan, but my parents paid for it. But I would call my twin and I'd say, like, you're using too many minutes. You need to wait till 9 p.m. Like, and I think I would go to therapy and say, like, we're really concerned. Like my sister is, wasting all
Yeah.
these minutes. And I'd say, we're having to pay, so I was a third parent in this dynamic. And I think for a while, I wouldn't have been able to hear my therapist really push and say, like, but you're not paying it, and this isn't your issue. And I don't know, I'm going on, but like your thoughts on your early experience when there is so much like codependent like language and behavior and how they describe an experience.
Yeah. I think that's a good question. And I think it's one that takes a lot of kind of art to it. Because I think in some ways you don't want to scare the person. Because I think kind of person who has codependency is using that to feel safe, or like there's a reason why that person is having is engaging in relationships in that way. It might be the only thing they know, and then trying to rip it out of that or rip it away from them then causes this terror. There's a variety of things. But I think when it feels very ingrained and intertwined in their kind of way of living, I think it's something that probably takes in my mind, can take some gentleness of starting to kind of be curious about it, or trying to kind of maybe ask more questions, or I'm not exactly sure. I'm trying to think about when that happens, how do I respond? I think in my mind, I'm really I think I notice it, but then also thinking about like, what can this person tolerate? Why might this person be engaging in this way? And maybe starting to be curious with them about it. But I think, like you're saying, like, I think it takes really a lot of time to heal and to feel safe enough to start challenging yourself with those thoughts and feelings. And so, especially at the beginning, I think just trying to develop that relationship so that they can start to feel safe,
Right.
and not kind of threatened or kind of scared to death about themselves. Because I think sometimes if you start pointing that out, then they're like, that the self-blame can start, and they're like, oh yeah, it is my fault, like I am terrible. And so just trying to be present to the moment and to think about what they can tolerate, or what might help get through to them. but I think it definitely feels very complicated and complex and not easy. And probably trying different things to see what the person kind of responds to. Yeah.
Yeah. Being curious, right? Developing the relationship. Yeah. Getting a sense of what they can tolerate. Yeah. I mean, I can't imagine like my poor therapist. Cause if, right, listening to that, I know sometimes I'm like, okay, it's I, not we. I'll think that. And then, yeah, I'll be like, this isn't your bill to pay. So I'm thinking that. And yeah, I'm like, what are these parents? Why are these parents like letting this girl fight this battle? So I'm like, I think that's about the parents. And I'm like, oh, this poor sister, like she's getting it from three of them. So I have all these thoughts. And then, yeah, it's like you said, you have the thoughts, or the observations, right? You noticing these things, but then it's like, oh, okay, like this is where we're starting. And then just slowly, like you said, putting words into their experience, right? Creating insights so they can change patterns. Because, yeah, that was not a sustainable, I could not be the third parent forever. I could, but that would be it would have been exhausting. So, yeah. Final thoughts on the dynamic approach.
I don't know if I have any other thoughts other than I think just really holding the complexity of kind of relationships, and definitely isn't easy to be honest with yourself about these things. And it can be really scary, and it takes time, and you can, like, something I've experienced. I've definitely healed these types of patterns, but then transitions happen, or traumas happen, or difficult experiences happen, and they bring up these patterns again. But kind of really just trying to accept yourself and kind of be okay, even if it does happen, because I think it's really easy when you're trying to get insight, it can be really easy to be critical, but just really acceptance and compassion can go a long way. I think those are kind of my last thoughts about it.
Thank you. Yeah, no, I loved what you said about your own experience. These unhealed parts of myself, right? They came to light. It's like, oh, that's such like a non-judgmental perspective, like unhealed parts. Like, can't do much about it, but or necessarily like you can't, it's not like you're walking around confident that you're healed, but something happens and then these come to light. So working through them. Yeah. All right. Well, if anyone is interested in learning more about you or working with you, where's the best place for them to go?
The best place would be my website, dynamichealingpsychotherapy.com. That I would say is the best place to go.
Okay. So I'll put a link to that in the show notes. And thank you for enlightening us on the psychodynamic approach. Everyone, check out Dr. Ann's website. And thank you for being here.
Thank you for having me. I really enjoyed it.
Awesome. All right, dear listener, thank you too for being here. And I will be back with you next week. Take care. Hey girl, it's Marissa again. I'm not like a regular podcaster, I'm a cool podcaster, right? Thank you for listening and staying till the end. You can find me on Instagram at Therapy with Marissa. Email me, marissa@codependency.com. Check out codependency.com for more information on the show. And baby girl, a subscribe, rating, and review would be much appreciated. Till next time, I want you to remember, if you are feeling unseen, I see you. If you are feeling unheard, I hear you. And if you think that you don't matter, know that you matter to me. I want you to go out there so you can stop playing small and start taking up space, you dummy. And now, the disclaimer. Girl, this is not therapy and I am not your therapist. This podcast is designed to provide accurate and authoritative information in regards to the subject matter covered. It is given with the understanding that neither the host, publisher, or guests are rendering any legal, clinical, or other professional service. If you want or need a professional, please find one.